Hello, everyone, and welcome to another episode of Coffee Talk in the Athletic Training Room. Today, we are joined by WaveOn Health founder and CEO Adam Halpern. Adam's true passions surround business development and revolutionizing the overall health of athletes. He loves to find a better way by challenging the status quo and creating a solution that makes sense. Adam works with athletes, retired athletes, athletic trainers, orthopedic surgeons, and more to provide optimal medical care and unique technologically advanced solutions. His unique business development outlook includes seeing an opportunity before others, creating a strategy for success, and most importantly, implementing the strategy. Adam has traveled the world with World Cup level skiers and witnessed excellence at the most extreme conditions, as well as worked with high-level elite collegiate athletes and everyone in between, and believes that everyone deserves the same level of attention and detail. Adam, welcome. Thank you for joining us today and talking about WaveOn Health. How are you?
No, I appreciate it. Obviously, when we write bios like that, we write it a long time ago. And then as we hear it back, it's kind of thinking about, is that in alignment with what I'm doing, what my passion is? Does it still make sense? And it does. So it was just coming out of your mouth that I'm kind of shaking my head like, all right, I'm still on the same path. I haven't diverted direction, that I'm still staying true to who I am. I appreciate
That is me. That is what I do. Yeah. Okay. Yeah. Okay. I thought so.
it.
Awesome. Well, can you just kind of take us through? I mean, first of all, I appreciate WaveOn Health, sponsoring the athletic training room and being a partner with us to promote obviously athletic training and sports medicine. As an athletic trainer with so many years of experience at so many different levels, you understand the need for athletic training and obviously the uh, challenges, for lack of a better word, facing the profession today. And I know that WaveOn Health is a way for a way to try to address those challenges in a new, unique fashion. So just kind of take us through how WaveOn came to be, kind of your thought process and development, and how you hope that it will help kind of address some of those issues.
No, it's a great question. It's obviously a very layered question. And to the listeners, I know I'm speaking to the choir, and I might just frame certain situations in a way that you might not have heard before. But it is always about the value that we bring athletes in all different venues, all different settings. So while I worked at Stanford and I worked with the US ski team, I was delivering what we all do on a day-to-day basis. And then when I realized that, you know what, there's more that I think I can do than help 12 skiers, I'm going to go find it, right? And I just took that risk and it's like, hey, let's jump ship and not be a traditional athletic trainer and go figure it out. And I worked in different settings outside of the traditional athletic training service model, but I was always attached. So I worked for Kinesiotape. I went to the London Olympics, built a relationship with the USOC to bring Kinesiotape to all of their medical professionals. I worked for an organization called the Dental Cooperative, which focuses on preserving independent dentistry. And then I worked for a technology company that really helps people utilize technology. And you bundle all that together with what we do in a day-to-day basis, I realized if we don't scale the profession of athletic training outside of what I call the one-to-one ratio, one athletic trainer to one athlete, one athletic trainer to one team, one sport, one school, it's a very limited service. Like, it's not scalable. And the only way to scale it is you have to leverage technology to help deliver that service. So there's a lot of backstory, a lot of failures, a lot of successes, but where we are now, as I describe it to everyone, including investors and organizations, we're a technology assisted athlete health service. And the reason I use the term athlete health service, and this goes back to athletic training and what we all do, I look at our value as a profession and what we've been doing for 70 years in person, which has a lot of value, is two things. We are the athlete's advocate. And then number two, we're the athletic health navigator. And if you think about those two terms, that has nothing to do with What are we covering? It has nothing to do with, am I a really good dry needler? What do I do in rehab? Those are single point solutions. So yes, we can do dry needling. Yes, we can cover events. But where athletic training is unique, we support the end-to-end comprehensive athletic journey. And once again, I know I'm speaking to the choir, and that journey includes prevention, early intervention, injury management, specialist referrals, and then recovery to get back to their sport. Athletic training is not a single point solution. It never has been. Hopefully it never is. But we as a profession are comparing ourselves to single point solutions instead of what is our unique quality? What is our value proposition that no one else has? And right, if people know me, and there might be some listeners that know like the brain of Adam, I've always said the profession of athletic training kind of when we wanted to be around the cool kids because we didn't qualify for a college athletic program. We weren't good enough. So then we wanted to be around the cool kids and we were helping the teams, the football teams. And that's kind of how the profession of athletic training started. Obviously, now we're a healthcare medical field. There's a lot of credibility. But I think that undertone still to we have little brother syndrome. Like we want to be physical therapists. We want to be primary instead of saying, what do we do that they don't do? Well, it's very simple. They do one thing well, and we do a lot of things well. And what does the general public want? They just want access to someone that's going to help them navigate their athletic health. Very simple. And when I talk about the leveraging of technology, we don't have to do that navigation and advocacy in person anymore. We don't need to stand on a baseball field in Florida in June when it's 100 degrees and 100% humidity. We can help athletes all over whatever state. So that's kind of the current precipice of where we are, which is pretty exciting.
Oh, absolutely. And I think you're right. I think that from a technological standpoint, I think that the pandemic period taught us a lot about how we can utilize technology, and how we had to utilize technology and how we can take advantage of some of that. And I want to kind of piggyback off of that. And I'm glad you brought that up because I think that a lot of times people or athletic trainers as traditionalists will see telemedicine and a product that utilizes technology and is not hands-on and is not in person as well. You're trying to solve a problem of less athletic trainers by providing a solution where people don't have to hire athletic trainers. And I think that, right, and not I think that's the argument that we hear a lot. And kind of talk about how that's not the case necessarily with WaveOn, or is that the case with WaveOn with what you're trying to do, and how does it address the shortage by leveraging the technology while still being a supplement to athletic trainers?
That is a really good question, which also has a lot of answers. So I will I will probably talk for a little bit to answer all that insight into the actual question. And once again, you have to use comparisons that helps an industry understand how to adopt technology. And a very simple one is the car manufacturers had the painters on a manufacturing line. And if those painters did not adopt technology into delivering their service or their job, guess what happened? Right? The technology literally wiped out their job because a robot can paint. But there were some painters that understood how to read the dashboards, understand how the technology can paint more cars at once, and they didn't lose a job. And I do look at athletic training in a similar model. The service we provide cannot be replaced by technology. It's impossible. Technology cannot do a Lockman's on the field. It cannot hold C-spine when something happens. That's not what I'm talking about. I'm not talking about that in-person, real rich value that we give athletes kind of in those emergency-based settings. That's never going to be replaced. However, there are athletes that just need a quick response time to get a question answered, and we're able to do that. And the real reason I know this is going to work, every listener, if I ask you, when was the last time someone asked you for help a current athlete, a former athlete, a coach, an administrator, a family, a friend, and you literally text them back, oh, this is what's going on, you're already doing it, right? Like, this isn't anything new. Everyone's just using your cell phone. That's just not a HIPAA compliant platform. There's no data record of it. You don't really know what happened 6 months ago. So I know we're on to the future because it's already been happening in the past. We're not replacing athletic trainers. We're creating a supplemental resource. So to kind of dive into your question about where and how this is working, if you look at the school setting, from high schools to colleges, we all know as athletic trainers, 1/3 of the high schools in the country don't have athletic trainers. And while our profession likes to stand on the mountaintop and scream, every high school in America needs to hire an athletic trainer, it sounds good on paper. It's never going to happen. And it has nothing to do about the value of our service. Zero. It's 100% about two factors: the economics. Does that school have the budget to hire an athletic trainer? And for athletic trainers, this is kind of an aha moment. Sometimes those towns that have a high school is so remote and so small, an athletic trainer will never move there. They will never live in that small town. They want to live in big cities. They have family in big cities. They're not going to move to a town of 1,000 people in the middle of nowhere, America. It's just not going to happen. However, by leveraging technology, we can create a vehicle and an opportunity and a service that every student athlete in America can have access to an athletic trainer. And the only way that's possible is we leverage technology. And remember, when I talked about that comprehensive end-to-end solution, that specialist referral means when an athlete needs the next level of care that technology cannot produce an answer for, or cannot produce the outcome, the athletic trainer can make that referral through technology. So we're on to something. I know it's working. We'd love to have more people kind of support the cause and work with us, but we're doing it in a way that is just taking the authenticity that has been in existence for 70 years in that 1-to-1 ratio environment, and we're just repurposing it. We're just putting kind of a concierge telehealth model on top of it.
Yeah, and I think if we can combine these things, technology is not going away, right? It's only going to advance. And I like to use AI as a model for that. I think AI scares a lot of people. And it's not going anywhere. People thought Google was going to go away, and we're worried about Google replacing the yellow pages, and guess what it did? But it did for the better. And so I think when we talk about technology, we have to either adapt to what is there and utilize it to our advantage, or we're going to get passed up by one other professions or become obsolete. And so I agree. I think that we need to at least take a look at how do we use these technological advances to our advantage um, as a profession to provide better care, because ultimately that's the goal, right? Is to provide better care for student athletes, for our athletes, our active population, however you want to term it.
So another way to look at technology that allows that service delivery model right now. And once again, a lot of the stuff I'm going to say is the Adam's unbiased opinion. So take it as you wish, right? I feel athletic training as a profession, not what each person does, privately and how they deliver their service, but as a profession, it is a very inefficient business model or service model. And the reason I say that, because technology is not truly integrated or utilized, the current platform is everyone's eyeballs or brain, and then there's a bunch of tools that they use. And if we go back to what's happening in the profession, athletic trainers feel they're overworked, they're undervalued, and they're underpaid. Well, it's because it's a very inefficient system. It's a very inefficient model that if we incorporate technology, and you can use AI as one of those, and machine learning, that if we decrease our 1-to-1 workload, we might become a more efficient service model which allows us to have a better work-life balance. We're not spending 80 hours doing evals every single week, plus creating personalized programs for the same injury over and over and over. We can kind of streamline it. And this is really important when we talk about the delivery of athletic training within the global healthcare discussion. That allows athletic trainers to work at the top of their license or the top of their scope instead of working with entry injuries, right, or lower caseload. We don't need to treat every ankle sprain as if it's a catastrophic injury. They're 90% of the same, and then technology can create red flags that allows an athletic trainer to appropriately provide more personalized care or help navigate the downstream healthcare system. And once again, that's the value of athletic training. And a lot of athletic trainers just don't see technology allowing them to be more efficient. And that's what I'm trying to stress with that statement.
Sure.
Yep.
And yeah, and that makes a lot of sense. And with that said,
Yep.
when we talk about from the athletic trainer standpoint,
Yep.
using this technology, becoming more efficient, what does the platform look like from an
Yep.
athletic trainer point of view? So I'm an athletic trainer. I sign up with WaveOn Health to be a provider. What does that look like? What does that look like for me? How does that look? And not only that, but you mentioned practicing at the top of the license, and with every state having a different practice act and different licensure, which is a different conversation for another day. Uh, how does that affect? How do the state practice acts individually affect the way that athletic trainers can utilize the technology?
No, it's great. You're asking great questions because there's a lot of ways to answer it. The first kind of level that I want every athletic trainer that's listening, we're doing everything above board. We're not trying to break any state licensure laws. We're just taking what you do right now and allowing you to help more people, more athletes, more active people, so then they can be treated like a professional athlete. So we're not putting you at risk. We're not putting your standing orders doctor at risk, anything like that. And then once we get past that risk mitigation mindset, it's then looking at, well, what does the experience look like for an athletic trainer? And this is really important for athletic trainers to understand. The mainframe, the secret sauce of what we're doing is actually the brain and the mind of the athletic trainer, which I talked about earlier. So all we're doing is allowing your experience to be scaled past that 1-to-1 ratio. And then within the environment, there's ways to streamline the efficiency and that patient care between that end-to-end solution. So obviously that's looking at how do we have prevention measures? How do we have early interaction to help discomfort or aches or pains from getting worse? How are we doing proper documentation? How are we communicating virtually within a HIPAA compliant platform, both text messaging and video conference calls? How are we referring to providers? How are we managing their recovery back to their sport through personalized programming and that communication? So all I want people to know is whatever you do in person, the technology that allows you to properly and securely do that on a scalable fashion. And then as we continue to grow, that technology tool will have more advancements. It'll be cleaner, more seamless. We'll get more data, which then allows the athletic trainer to be more powerful.
If I'm an athletic trainer though, and I sign up to do this, right? Am I on call 24/7? Is it like I'm an Uber driver where I sign in and I'm on call while I'm signed in and then I sign out? And I think the other question people are going to ask is, what does this look for me from a financial standpoint, and how is it compensated? Is it hourly? Is it patient load based? And how is that structured and things like that? Has that kind of stuff been worked out?
It's always going to be improved. So the phase of the company, because we're a business, right? I'm not trying to shy away from it. We will always look at and review what's working for all the stakeholders. The number one is the athlete. The number two is actually the athletic trainer. And then how does it impact the business growth? So yes, we have some current standpoints that it's not based on hourly. It's not a call center. and it's not based on a 24 service model. I'm always referencing the authenticity of athletic training because I know that's how athletic trainers think. The authenticity of athletic training is when you work for a school and you give a lot of support to the athletes and it's ongoing, instead of the personal training industry, which is they pay based on sessions, or the physical therapy industry, which is you based on appointments. That's not athletic training. Like, we don't sell a 12 pack. We don't have 12 visits. We're based on, hey, we're always available. And whenever you need me, let me know. But that, in the core foundation, is really built on trust. Healthcare is sick care, and personal training is kind of an enablement model, right? It's like, oh, well, you can't get stronger if you don't see me 3 times a week for 12 years. Whereas athletic training is, no, we're always here. We want to have a line out the door. We fix you quickly because we want to empower you. So the reason we're building a model out that the school or the team, they just pay a subscription fee and they get access to the athletic trainers to do that end-to-end comprehensive solution model. And then the athletic trainer gets a good chunk of that service. But if we look at what we do as athletic trainers, there's going to be a lot of interactions that might be 1 minute. It might be 5 minutes. We're not doing an evaluation and a full program in front of an athlete for an hour. Now, it's not 24/7 service. It's not going to be that type of model. If you have technology company or services, which we all do, sometimes you have to put a ticket in and then they respond. We're not doing emergency medicine because we're not there. So if anything is an emergency, guess what? We already pay for 911 in our taxes, right? They already have that service. So it's having the trust built because an athletic trainer is attached to a group of athletes, which then allows them to deliver the traditional athletic training service instead of an on-call emergency service. And that's why it's not an Uber model, that it's not a random group of athletes getting attached to a random athletic trainer every single time they need it. They're going to have consistency. And most importantly, to pull the healthcare terminology back into the discussion, that is continuity of care. And if we have an athlete that does need the downstream healthcare provider, the authenticity of athletic training is we're triage, which then allows that specialist to focus on their scope of practice or the practice at the top of their license. So that continuity of care works on both ends, with us at the top of our license and then the specialist that we provide the resource to.
As athletes come into the program, the platform, and athletic trainers are treating them, it's talked about continuity of care and it's consistency and all of that. As we triage as athletic trainers, do you bring in physicians to the platform? And what I mean by that is it like a preferred provider type of a system based on the athletic trainer, based on the area, partnerships with hospitals, physician groups, et cetera, to refer out? Or is this kind of based on the athletic trainers' experience, their connections, their network, where they're located, that they make that decision on who this to refer the athlete to individually of the platform? How do you work some of those kind of things?
So once again, as a scaling, growing company, every thought you have are both suggestions and strategies. So every market that we go into is a little bit different. Sometimes there's an athletic trainer that's the point of entry and they have all that built out. And we are not trying to replace anything because, once again, the authenticity of athletic training is this ecosystem that we built, and that's the value that no one has ever really capitalized on. So it's looking at that, and then how do we scale it so everybody wins? Or we might get an organization that loves what we're talking about, and they have athletes throughout the country, and then we would need to build out that ecosystem in each market, with the athletic trainer maybe being the cornerstone of that development. So every situation is going to be different, but it is looking at what is already established, because once again, trust is really big in athletic training. If a provider trusts that an athletic trainer can make the appropriate referrals, based on the scope of practice and the licensure and skill set, that's scalable. So yes, yes, yes. Everything you said is correct.
You mentioned earlier, shifting gears a little bit, you mentioned earlier not doing emergency medicine. And, one question I hear as I discuss this with people is how is it, what guardrails are in place to prevent those from coming through the system to the athletic trainer where, okay, now I have to, as an athletic trainer, I have to field an emergency question. And I mean, obviously, it's going to be a go, see ya, right? Call 911. But if I'm a young athletic trainer and I'm trying to address some of those issues and kind of get a history and stuff over the phone, when I'm not there, I can't see it. So, are there guardrails in place to kind of prevent some of those things from coming through where athletic trainers are a little more protected from that?
Good question. Remember I mentioned the HIPAA compliant
Hmm.
platform? There's a video chat. Hey, show me your swelling, show me your discoloration. Oh crap, you got a bone sticking out. Yeah, you got to call someone, right? There's ways that are already integrated to do that. Like with any company, it is going to be writing the roadmap as we go. And part of what the profession of athletic training teaches, which has been the challenge of building an innovative company within athletic training, a startup, you have to jump in the deep end and say, okay, let's go and let's figure it out. The profession of athletic training teaches us, right? It's part of the education. Everything has to be vetted, everything needs to be validated because we're that trusted resource with the athletes. So as we scale, it's gaining the trust of the athletic trainer of, hey, that's a good question. Let's go build it together. And some athletic trainers are early adopters, some aren't. But we keep on moving forward because we're finding those right athletic trainers. And if we go specifically to the emergency medicine on a phone call, athletic trainers from a clinical perspective are giving us feedback because I have to listen to the feedback and how do we put a good product. There might be a athletic trainer that's new to their career and they have a great idea and then it's implemented into what we're doing. So
Hmm.
I don't want anyone listening to think I have all the answers or we are already there. No, it's growing, it's evolving, and some of the concerns is what's going to make the product amazing. Right? Just the example from a technology company. All of us use Facebook, or actually some of us don't use Facebook anymore, right? We're all going Instagram. But
Everybody
what
in this group's using Facebook.
I know exactly. But what the platform was for Facebook when Zuckerberg had it in the dorm room is completely different than what it is today. And that's just what athletic trainers need to realize is it's good enough right now, which is better than the alternative, which is nothing. And it's only going to get better, which is the exciting part of leveraging technology to our athletic training service.
Yeah, and I think a lot of those athletic trainers coming out now that are more advanced with technology or let me just not advanced, but that have experienced technology throughout their schooling, right, their entire life. When you and I came up, we were where Facebook really wasn't even a thing yet, right? And technology was not even close. I mean, word processing was like I hope we have, my word works, I guess. And so in EMRs, we're barely even coming out, right? So I think it's advanced so much. And so a lot of these athletic trainers now that are coming out and graduating in the entry level master programs and things like that are using technology on a daily basis. And so I think they're going to have a lot of really good insights into this. But not only that, I think they're going to have a lot of uh, experience with these kind of things to be able to incorporate this into their practice, um, as much, if not more so than anybody else, because they're going to understand how it works and how it can be utilized, from that kind of a mindset.
So
Um,
a couple of points about everything that you just said. Right, I'll make myself sound old. I grew up in New Mexico, went to a small high school in New Mexico, went to college in New Mexico. I didn't get a cell phone until I moved to California for grad school, right? So if you're listening and you're in your early 20s, you probably had a cell phone when you were in elementary school. I didn't get one until I was what, 22, 23. So it just kind of highlights how advanced technology is and how it's part of our life. But I will say this because this is really important for the listeners around how our service can be delivered virtually. And remember, the athletic trainer brain and experience is a cornerstone of what we're able to do. while new athletic trainers might understand how to use technology, they actually don't have enough experience under their belt to know what an ankle sprain looks like because they haven't seen 1,000 to 10,000 ankle sprains. So newer athletic trainers kind of have a limiting factor on how they can deliver the service. I kind of feel our sweet spot are athletic trainers that have been in practice for at least 5 years, and they're kind of at that threshold of, I want to help more people, I want to make more money, I kind of have a grasp of shoulder discomfort, low back, knee, I've seen enough, I'm kind of that expert, how can I help people through the text messages that I'm already getting? So I say that to kind of support the older group, not just the new guys, that your experience can be scaled, and it's not just a new athletic trainer model, it's more of a more experienced, I can help people, and then how we kind of scale in the financial model for an athletic trainer, because I didn't mention that, is we're putting the athletic trainer as kind of the point of entry and point of contact within an athletic community, within a city, or within a town, or within a state. And once again, that's what's never been capitalized on for athletic trainers, that by being that point of reference and point of contact, there's a huge financial opportunity for them. But in order to be that point of contact, you have to have a lot of experience under your belt. So it's kind of a chicken or egg thing. Like, to be successful, you have to be an athletic trainer for a little bit, right?
I mean, like you said, sometimes you just gotta go for it too. So,
Yeah, you just got to do
um, yeah, I mean, I think having that as the athletic trainer as a point of contact is also going to boost the profession and really highlight the profession in a way that hasn't been done before from an advocacy standpoint, as far as what we can do and put us in positions that we haven't been able. So that could be a really good opportunity
it.
for athletic trainers.
Well, I mean, I'll just ask you, and you don't need
Mhm.
to give names or specifics. But I guarantee if I ask you, do you have a shoulder guy or gal, a knee guy or gal, a great provider that's amazing with low backs? You're gonna say, what are you gonna say?
I would say go to that.
Yeah,
Go to that person.
everyone has
Yeah.
their guy or gal in every city across the country.
Yeah.
Athletic training is already
Yeah.
navigating athletes' health within the healthcare system because they know who is really good at what the athlete's problem is. Right? Guess who doesn't do that? Orthopedic surgeons, physical therapists, general sports med docs, right? They do what they do well. That's that single point of solution I'm talking about. And athletic training is already providing that navigation of through the expertise of their market. That, I mean, there's so much value in that because that's a convenience factor. How much time are we saving the general public from going to urgent care, going to the emergency room, seeing their primary? It's a waste of time. Athletic training does that on a daily basis.
Well, and that's the added value of the subscription too, right? Because
Totally.
you're not paying the co-pays and the insurance fees and
Yep.
waiting and waiting and waiting, where you just, okay, yeah, this is something, go to this person, this is where you need to start, etc. So
Bingo. Yeah.
certainly. And and athletic training is so much about networking and who you know and who you get to know, and that's how you find out who is the shoulder person and the back person and the provider for, you know, the general medical issues, your person that you go to. Um, but also I think that not only that, but athletic training is a networking position from a setting
Mhm.
standpoint, right? And so we have emergent settings, but we have emerging settings as well, right? Like industrial has really grown over the last decade. Military has really grown over the last decade, and more of these emerging settings are coming out. Specifically, youth sports organizations are now hiring athletic trainers more and more. You're getting a lot of people hiring athletic trainers for their events, even adult kind of situations. Oh, triathlons and races and marathons and things like that, hiring athletic trainers to work these events. What kind
Well,
of what?
like
Sorry,
when
go
you
ahead.
say that, why are hospitals and clinics hiring athletic trainers? And we all know this term, to do outreach. Like, why are they doing that? Like,
Oh well,
there's
yeah, no, hospitals and clinics are doing it in order to make to get the patient load.
They look
Obviously,
athletic
right?
training as a patient acquisition vehicle.
No, no
Like
doubt. Yeah,
that's huge. That's a big opportunity. And athletic training is doing that at the expense of everyone else. And we're just flipping it. We're saying,
right,
okay, well, we're creating a model that the athletic trainer is not an expense on their budget. We are the key holder of that local community, and we can refer to multiple providers based on who's good at whatever service, based on what insurance that card holder has, like what family
right.
insurance is there. We can navigate that local healthcare system.
Sure. Yeah, no, absolutely. And with that said, what I was getting to is what kind of organizations are you finding the most success and buy-in from as
Mhm.
far as being partners in this? So hospital systems, youth sports organizations. I don't know, I'm throwing Little League out there
Oh
just
yeah,
because
it's
it's the
fine.
first one that came off the top of my head.
Yep.
Staffing services like a Go for LS or something like that, where they're hiring athletic trainers for tournaments, but maybe you're not getting the full history as athletes come in because they're coming from all over the place. Have you had a lot of success in one realm or another, or one setting versus another already? And how do you look, or where are you looking to expand that into kind of in the near future?
The most success that we've had is from the profession of athletic training, from the associations who realize this is a way to increase jobs for their members. And that's at the state level and that's at the district level. They're like, you know what? You're creating the solution to a lot of our labor crisis problems, right? And then in conjunction, you have the state high school associations that realize the problem we're addressing is impacting their state tournaments. All of the athletic directors, coaches at small schools, and some big schools are saying, we can't hire athletic trainers, right? So that's kind of that riff on a state level. And we come in the middle that we're creating jobs for athletic trainers and we're providing athletic trainers to those schools that either can't hire anyone at all or that existing staff is overwhelmed and we kind of have that supplemental expense. The next question out of everyone's mouth is, well, who's going to pay for it? And that goes to what you're saying. What organizations are you gaining a lot of support from? In the last week, there's two major hospital systems that are interested in working with us. And when I say us, it includes the athletic trainers on the phone call because they are getting interest from those high schools that are outside of their urban settings, but that high school cannot, or that hospital cannot put an athletic trainer in that small town. It just costs too much money. It doesn't make sense. So by leveraging our virtual athletic trainer model, maybe their existing athletic training staff is the one that is delivering it to those small schools and navigating their health remotely. And that's pretty exciting. We are getting interest from a very, very large like sports organization that has memberships. So it's looking at how can we include our service in, we'll say, a membership fee, right? So as athletes are paying membership dues to be part of national governing bodies, imagine if every athlete had access to an athletic trainer, just like every student athlete should have access to an athletic trainer. So that's kind of where the phase of the company is. We have validated the service. People really like the concept. Now we're putting on our business hat and saying, okay, who's the actual paying customer and how can we scale? And that's, I kind of said it earlier, it's a chicken or an egg thing. I can get athletic trainers all day because they like that there's an opportunity for them. But if we don't have athletes for them to work with, they're just kind of sitting around twiddling their thumbs. Or if we get a sports organization or a high school with no athletic trainer, we're not able to deliver the service. So it's
Sure.
just working it out, right? And kind of navigating together, shimmying down the road all at the same time.
Putting on an entrepreneurial hat, I guess the
Yep.
next question, and you kind of touched on this a little bit. What's next for WaveOn Health? What's next in the arc of the company? What is coming? What can people expect coming down the pipeline from you in the near future?
No, that's a really good question. I mean, from like a day-to-day functionality execution, we need to get more users, pilots that validate all of the unknowns, so then we can continue to improve the service. but that also validates we need and can get some early stage funding, which allows us to scale with sales and marketing, onboarding, recruitment, training of the athletic trainer, and even having some of the team members like solely focus on what we're doing so we can scale and grow. So if we look at what are some big things that we might, I don't want to say publish, but promote, is new pilots, new markets that we're working in, new organizations that are raising their hand. Yeah, we want to have a virtual athletic trainer, and then also asking for athletic trainers to work with us. And when I say work with us, this is not to replace your current job. I talked to a Division I football athletic trainer that loves working football. I don't want them to quit their job, but they literally can support athletes within their community on the side, kind of as a gig economy whenever they're available, because it's not a 24-hour on-call service. It's really just navigating the time that we all have available in our schedule to support more athletes. So if anyone has any introductions to organizations and they want to help people, obviously those introductions help with those promotions of how we're growing as a company.
Well, if anybody does have any introductions, or if they want to become part of the pilot program, or a member, or a subscribing member of WaveOn Health, how might they go about doing something like that?
Yeah, the easiest way is literally to find me, right? So I'm on Facebook. Obviously, that's how we know each other. The only platform I don't use a lot is actually Twitter, X, whatever term you want to call it. But Adam at WaveOnHealth.com is my personal email. LinkedIn, I'm very active on, so you can send me a message, we'll connect. Or if you're an athletic trainer that's like, I just want to be involved, what's the fastest way to do it? If you go to WaveOnHealth.com and you'll see get started, you can put yourself in as an athletic trainer. I heard Adam on this podcast and I want to be involved. There's like a comment section, and then we'll get you kind of tapped in to how we can get you paid for referrals and or delivering the virtual service. So we have a very unique opportunity for athletic trainers to scale your personal Rolodex that you've been building for your entire career, and then allow you to get paid for helping more athletes in a virtual model. But Adam at WaveOnHealth.com or WaveOnHealth.com is the best way to connect with me.
Awesome. Athletic trainers, we will put that information in the caption and down below, so you can click on that and follow that to learn more. And obviously contact Adam for any more information that you, or any more questions, or request information regarding WaveOn Health. Adam, thank you so much for your time today. We really appreciate it. Really excited about what you guys are doing at WaveOn Health, and can't wait to see what's in store in the future.
No, I appreciate it. I'm very open, transparent, so I look forward to any more questions. Thanks for the time.
Thank you.